Now, I know enough about it, I think. And then I realized I don't have time to put together a presentation. But I was at a meeting about a month ago, and a friend of mine from the Navy did exactly what I would have put together for this. And another friend from the University of Iowa did some stuff. And so what you're going to see is stuff for the guy in the jury grant mostly put together. And so you'll see him talking, and he developed a very extensive program that does enable hospital to set them up to be rebuilding soldiers who are coming back that were disfigured in that area. And so you see a lot of the applications I'm talking about is maxillofacial surgery. And I'll show you some dental implant stuff as well. There isn't as much going on in medicine. And kind of another overarching concept is that, I was going to ask, what are you expecting to hear? What do you think is going on out there in additive manufacturing with medicine? And they're building body parts. Not really. They're building aids to do the surgery. They're building scaffold material. They're building devices to be used in the surgeries. They're building guides so that they know where they're going in, or they're building practice models so that when they go in, they know what they're seeing. And they know that they planned it well, or they're planning on the computer 3 or 4 different approaches and figuring out which one's going to work. So it's a mixture of getting input into the computer, so getting digital data sets from the surface of people, from the bones, and then taking that and manipulating it in the computer space using a number of different programs, sometimes taking 2 different imaging files and merging them for the purpose of I'll show some examples of how that's used, and then outputting it in any number of ways. A lot of what's going on is still in dentistry, routine dentistry, and dental lab milling of things. It's not additive, but it uses the gathering of the data and all the computer manipulations to get there. And people are working on developing better the additive approaches because they're much more cost effective using pure materials. But that's robust with powdered metals, and I'll show you some examples of that. But for plastics, it's more the prototype stage. So if you want to build a prototype of something you want to test, or here's my design, what do you think? You can do that. So that's going to be done a lot. And with ceramics, that's probably the class of material that will come along the slowest. So we're seeing this being applied additively using ceramics. It's calcium phosphate ceramics, and they're building scaffolds for bone repair, but it's still experimental. It's not being used clinically yet. And they can also be additive. You can print cells in these things. You can print growth factors that help direct the development of the structure. So that's kind of an overall big picture. And then I'll show you, some more big picture stuff, some details about what's going on, and some examples. What's happening here to be building shells to guide surgery. We could be building it to then fill it in and make a replicate. So here you have reconstructions, combat trauma. They're registering these patients actually before they go to the war zone. And so that those who maintain records of what these folks look like with the surface mirage and also with X-rays before they go, so they know how to construct them when they come back injured. This anatomy can be isolated in these constructions. You can take the undamaged side mirror images and apply it to the damaged side. Here they're using burn dressing devices, so this is an example of doing that. It really speeds up the healing. You get a better result cosmetically if you have this technology. And the only way you can get there is out of the manufacturer. Lenses, of course, custom devices. This is a custom hearing protection communications device. It's instantly fits the patient and is all ready to be attached to whatever the device is that they want to attach communications device to hearing aid.
We're down to color. So these are real helpful because a lot of times the surgeons want vascular models so they can see if there's an aneurysm or something. So because if we get the right kind of image, like a CT scan that has contrast in it where it shows the arteries and the veins, then we can actually separate out those arteries and veins and color them a different color. It'll come off like this on the machine, which is kind of, think of it like a greenware on ceramics. It's kind of like this. This is relatively fragile. So what you have to do is you have to do something in the bones to process this. So we have two options here. Generally what you do is you actually coat it in super glue, and it makes it solid on the outside and that makes it relatively hard. Or you can actually pour resin through the whole thing, and we do that sometimes. The nice thing about these models, if you do resin through it, is then they cut like bone. The beauty of doing it layered like that is if you do cut this like bone, what you would see in the bone is what you would see when you cut.
These are all examples of additive manufacturing models that are then being used in treatment. So in orthopedics, complex fractures are being handled this way. Heterotrophic ossification is being treated. Neurosurgery, cranioplasty, aneurysms, isolation of tumors, drug fabrication, bioprinting, bioplotting, bioassembly, maxillofacial surgery, we have the reconstruction, custom fixation devices are being built, surgical guides, so that you know the contour that we're trying to accomplish during the surgery. I'll show you an example of where they're building a mandible.
And it's controlling the outcome and really increasing the possibility of success in all of these cases that I'm showing you. And that's something that's true. Even I visited the largest dental lab in the country, got to know the owner, and he's automated. I wanted to go in and see where he automated and how it worked out. And every place that he's automated, his costs have gone down and his quality has gone up. You know, it's just the nature of using this technology, you know, whether it's for face transplants or making, you know, single gold crown.
So may I ask you a question?
Yeah, yeah.
So what's the difference between a face implant and if you're structurally doing something to the face like a burn victim? Is that considered similar?
The first part of your question?
Oh, a face implant.
Oh.
So what's the difference between that and doing a structural something to a face, like a burn victim?
Oh, well, you're dealing with structure and you're dealing with aesthetics. You're going to have a whole mix along, you know, either end of that spectrum, depending on what you're trying to do.
Okay.
You know, so even replacing an ear, you're saying essentially what started out life as a dental implant and morphed into a smaller implant to use to, you know, put an ocular prosthesis or an oral prosthesis on.